Very good to go.
Greetings to all. Myself, Dr. Anuj Maheshwari, Governor, American College of Physicians India Chapter. I welcome you all, those who are joining from India as well as those who are joining from outside India. First of all, I must pass on my best wishes on the occasion of Vijayadashmi. Vijayadashmi is a very important festival in India which is celebrated on a note of trump of goodness over the bad evils. So we are doing the similar kind of the things for the doctors today, where we are going to find the solutions of multiple problems of the doctor. As we all know that there are a lot of things happening across the country in which many doctors are finding themselves in trouble because of the professional reason, sometimes because of the personal reason, and multiple things are behind that. Sometimes it is the paperwork, sometimes it is the bureaucracy, sometimes it is the lot of management things which are coming in their way because of what they are not finding their life adjusted with the circumstances. So what I feel that in last many episodes of the Soul Curry, we discussed a few problems of the doctors. Like in India, doctors are living lesser as compared to the rest of the population. Life expectancy is comparatively lesser in the doctors. In India, we find that doctors are more stressed, more tendency of the suicides among the doctors is there. They are not really coping up the smallest stress, and many a times they prefer to finish their life in multiple situations. So it is important to make them stronger from the inside. At the same time, what we have also discussed in few of the occasions that female doctors are finding themselves more troubled for various reasons. Next episode, we shall be talking about the gender bias regarding the female. But in this particular episode, we are taking up to a very important issue, that is the sexual health among the doctors. We all know that in India also as well as outside India, there are a lot of broken family, lot of divorce occurring among the doctors. And they are comparatively more than other professionals. They are comparatively more than other populations and other communities. So what we think that there may be some reason because of what they are keeping themselves busy. They are not finding enough time for their family. They are not really getting enough interested with each other. And it happens most of the time when one of the couple is doctor and another is not a doctor. They may not be adjusting with each other with the irregular working hour, and multiple things may be coming up in their relationship. Today we are having with us a very expert of sexual issues in India, Dr. Jumani. Before I introduce him, I will request my colleague Dr. Ajay Tiwari to tell the concept of this program, which is named as Soul Curry, and this is from the Wellbeing Lounge of the India chapter. Over to Ajay.
Thank you, Governor Professor Anuj Maheshwari. So it's always a pleasure when I'm interested with the duty, and this beautiful journey started with the first step on 15th of August, the Independence Day of India, and the first invite was our very own Professor Anuj Maheshwari, our governor, and uh, and he moved us through his journey from being a well-being champion to the governor of American College of Physicians. Thereafter, we had a program with Marion McCurry about the physicians burnout, and thereafter we had a very interesting program on the ingredients of soul curry. So the spiritual aspect of what the health is all about. And now today we are moving to another aspect, that is the sexual health. and which is also of paramount importance, and it is already incorporated in the World Health Organization definition. So for this, we have a very eminent speaker, and I would request our Governor, Professor Anuj Maheshwari, to kindly introduce him. Sir, you are muted.
You forgot to mention one that we did with Dr. Elisa Choi.
Yeah, and it was a physical program. Yes.
Yes. And it was really a very interesting program when we did it with the yoga. So, although in India, Dr. Deepak Jumani doesn't require any introduction, especially among the doctors. But outside India, he may be requiring introduction to some people. So, just for the customary, I shall be introducing him. Would like to have his introduction slide, if it is there. Okay.
Sir, we'll go with the usual
No
invitation.
problem. I can find it in our invite. Dr. Jumani is the senior sexual health physician and counselor at JJ Group of the Hospitals and Grant Government Medical College, Mumbai. He is also associated with the Mumbai Police Hospitals and Breach Candy Hospital. And top of that, he is very much loving colleague of all of us, whom we find in our almost every conference in India, which is happening on the various subjects of uh, medical fraternity among the various medical specialties. Because sexual problems always come on our requirement as well as our needs at the same time whenever we need to address some problem. So Dr. Jumani is always required for that. And today we have also invited him for a very different perspective, that is well-being of the doctor. I don't think he would have taken up this issue before, or he might have been taken one or two times. He will be telling, I think he will be the best person to tell us about his own experiences. If he has ever discussed these issues for the doctors, among the doctors. But today we shall be having a very interesting time, a very good time with Dr. Jamani, when he will be telling his experiences and his ideas and advices regarding the sexual health, especially the art and science of the sexual health of the doctors. Over to Dr. Jumani.
Oh, thank you very much, Anuj Bhai, for this very sexy introduction. At the outset, I'm really honored to have this platform to share my views, thoughts, concepts, and passion. Many a times, many people who come to us, many patients who come to us, they think we doctors are disease proof, like an electrician is an electricity proof, current proof. We are also human beings, we also have issues. We also are having this, being in the rat race, exposed to all the damaging things which are there. We have genetic issues, we have hereditary issues. So there are so many things which are involved, and we are also like normal human being, vulnerable to various issues which our patients also get it. So many a times it's very difficult for a doctor himself to, agree or to admit that he has these issues. So in this next 20-25 minutes, I'm going to give you some nuggets of wisdom as to what are the common issues in the sexual health of a doctor, and why they are there and how they can manage it. So around the world, people love. They sing for love, they dance for love, they write poems, they write legions, they build monuments, they kill for love, they die for love. So in fact, we all are victims of love. We are all born out of love and sex, and we don't talk about it. Patients don't talk, doctors don't ask, and many doctors. In my practice, I have 40% of my patients as doctors who are having these issues. They all are suffering, they all are having issues, but only thing they need to come out open and talk about it. With pranams to God and thanks to my teachers, Dr. O.P. Kapoor, Dr. Prakash Kothari, and Dr. Shashank Joshi, I beseech them to bless me always. I have no conflict of interest. What are the common issues with doctors? Of course, burnout. We all know we work very hard. We have late nights. We are deprived of sleep. We get fatigue. We have low vitamin D because we're sitting in the AC chambers, driving in AC cars. Of course, we are also vulnerable to cardiovascular disease, diabetes, hypertension, obesity. When you look at all these things which we doctors suffer from, I don't think so any doctor is not suffering from any of these. We all are. And all these lead to sexual dysfunctions in some way or the other. When you talk about burnout, now what happens is in burnout, when we okay, doctors are, we all are stressed. We see 100 patients, sometimes 120 patients, sometimes so many patients. We have to travel here and there, weekends. We go to various hospitals, etc. So we, in our profession, are undergoing severe stress and are exposed to so many issues of various patients which we need to tackle. And despite hostile attitude towards patients, there are many medical errors which can happen. And we have also sometimes, due to politics, due to red tapeism in the hospitals, we are having difficult relationships. Burnout among doctors also increases the risk of depression, anxiety, sleep disturbance, fatigue, alcohol, and maybe drug abuse. There are sometimes marital dysfunctions, premature retirement, and perhaps most serious, many a times even doctors have committed suicide. When we are sleep deprived, you know, so what is the thing which we go for? We have fatigue. See, fatigue is a very broad spectrum term. It reduces your cognition. You have various different lower performances. You neglect certain things. You decrease your learning. You have a decay in solving the problems. Your memory is at stake, and you have motivational decline. So how do we solve this? We need to optimize our schedules, and we need to improve our sleep habits. We need to make use of some power naps in between, and you can take little stimulants. And of course, melatonin is fantastic. Now we have spray available, which you can use it every day. Nothing wrong in that. Very safe, not addicting at all. Vitamin D, we are sitting in the AC. Most of the hospitals have air conditioned rooms. We have air conditioned chambers, air conditioned car. And it is seen that low vitamin, when we did a study of all the doctors in Hinduja Hospital, where I was there, all the doctors had hypovitamins, all the doctors. So vitamin D deficiency is also known to produce erectile dysfunction in patients who are diabetics or even non-diabetics. There are a lot of lifestyle associated risk of cardiovascular diseases among doctors and nurses working in medical colleges. This is a study from Tamil Nadu. 31% of all study subjects and 49.2% of doctors were at high risk of cardiovascular disease. So we are prone, we are vulnerable, we are exposed to so many things which can result in the morbidity and mortality of the doctors also. And of course, as we become senior, advancing age is a statistically significant group, which we all know about it. Doctors drink, doctors smoke. I don't understand why when we know everything. So the association between increased consumption of alcohol, which we see in the conferences, etc., they do affect. Amongst we doctors, we sexual health physicians, we know that increase in alcohol will definitely decrease your desire. It may stimulate you to some extent, but it will decrease your performances. So there is definitely an effect in your sexual life if you are taking excess of alcohol. So there is no advantage per se of alcohol. There is only disadvantage of alcohol. Cigarette smoking has been very common in doctors, dentists, nurses, etc. In health professionals, it has been seen. So this also reduces the blood supply to the reproductive organs, and they develop sexual dysfunctions also. When we look at conferences and CMEs where we go, I have seen myself, they come for cocktails, they come for entertainment, and they come for meals. Many of them I have seen, they just go there and they attack the food like they've never eaten food before. So somebody beautifully said the word for CME is cocktails, meals, and entertainment. Now, when you talk about sexual fitness, it's all about understanding that it is absolutely possible for you to take control of your health, your own pleasure and passion. You can play an active role in maintaining them. You have to believe in your ability to make yourself sexually fit. You have to value the importance of sexuality in your life. You have to focus on prevention rather than treatment. India is a diabetes capital of the world. When and I have so many doctors who are diabetics who come to me. Now, what is the thing which happens to doctors who are diabetic in their sexual life? Erectile dysfunction occurs as one of the first problems. And in these patients, they have hypogonadism. They also have low testosterone. So if you are a diabetic, definitely or obese, you will have low testosterone. Now, testosterone is the foundation of a male sexual response, which increases or which is depending on which your desire depends. So you need to understand there will be erectile dysfunction, there will be low desire in these patients. So we as physicians, or even diabetologists, or even others who are treating doctors, they should not just look at the diabetes, reports like HbA1c or insulin level or what. They should also address the sexual aspect of their patients. Diabetes is an established risk factor for sexual dysfunctions in men. There is increase of threefold risk of ED has been documented. Okay. There are various causes of ED, which are seen in doctors. It could be spinal cord injuries, it could be Peyronie's disease, it could be hypogonadism, so many drugs and all these things which are there. But one thing which we all learn is, if you want to be normal, or if at all anybody is normal, what happens in him is his nerves stimulate, his vessels circulate very well, his muscles facilitate, and hormones regulate. If all these four parameters are okay, he's fine. And the onus of making all these things in a right way is with the doctor himself. This is our first study of KM with 56 patients, 1,000 patients. All males diabetics had ED, early ejaculation, low desire, and females had low desire and depression, which was very common. So it's a huge problem. Sexual dysfunction in doctors, in diabetics, having diabetes is a big problem. It is the problem with the individual and also affects the partner, and there is definitely a dent in their relationships. Now, let me give you a newer perspective. I'm adding little scientific material in to make you all understand as to what do we have to give or to take in case if we face these issues in our own self. So we all know a normal endothelium, and this is the corpora cavernosa, produces normal endothelium. Remember, normal endothelium produces endothelial nitric oxide synthetase with the help of a metabolic amino acid L-arginine. Now, mostly this endothelial nitric oxide synthetase potentiates the chemical signaling molecule or the miracle molecule nitric oxide to initiate the whole erectogenic mechanism, conversion of GTP into cyclic GMP. This cyclic GMP relaxes the smooth muscles of the corpora cavernosa in the penis and allows the blood to flow in. But sadly, this cyclic GMP hydrolyzes into 5-GMP with the help of an enzyme called phosphodiesterase 5. Now, when you look at this, what do you understand? That the whole erectogenic mechanism begins with the entry of endothelial nitric oxide synthesis. And this will be produced only if you have a normal endothelium. Secondly, you should have adequate amount of nitric oxide. Nitric oxide is the main chemical signaling molecule which initiates the whole. So today what we have in our therapy is, all we have is not to allow the cyclic GMP to be converted into 5-GMP with the help of this enzyme, phosphodiesterase 5. So we have PDE5 inhibitors which we have in our armamentarium as sildenafil, tadalafil, sildenafil, vardenafil, and now new kid in the block, avanafil. So here is the you just block this PDE5 and you let the blood remain inside the penis. But what happens to diabetes? Because of advanced glycated end products, the elasticity of the blood vessels is reduced. So the flow is reduced. There is blood, but the flow is reduced, and hence there is a difficulty. So in hyperglycemia, due to advanced glycated end products, inflammation and oxidative stress ultimately all leads to functional alteration and erectile dysfunction. So every patient who's a diabetic will have erectile dysfunction due to endothelial dysfunction. This is what we should understand. So when we look at the corpora cavernosa of a diabetic, there is glucose overload, increased advanced glycated end product, increased reactive oxygen species, ultimately leading to reduced nitric oxide. See, nitric oxide as such reduces as we age, but in diabetics, it reduces earlier, and there is increased apoptosis at the endothelial level. And secondly, there is definitely reduction in testosterone in diabetics, which results in corpora cavernosa, smooth muscle cell dysfunction, and ultimately leading to erectile failure. So if you are a diabetic, you need to understand that just PD5 inhibitors will not help you. You need to supplement yourself or take testosterone or anything which is similar to testosterone to have a good enough sex life. So according to Paul Van Hart, who was my teacher in Mayo Clinic when I was doing my PhD, he said, you are only as old as your endothelium. So endothelium is what is deciding your biological age. You may be 40, you may be 60 chronologically, but your endothelium will decide your biological age. Now, a beautiful article said that testosterone, besides stimulating the production of endothelial cell mediators, it is also thought to promote vasculogenic re-endothelialization process mediated by bone marrow-derived endothelial progenitor cells. Additionally, testosterone seems to modulate other erectile tissue components, which include trabecular smooth muscle cell, nerve fibers, tunica albuginea, and all which are essential for erectile process. So take this as a message that if you are diabetic, you may need PD5 inhibitors in a very low dose form. But yes, your testosterone level has to be normal, because that is responsible for the structural and the functional integrity of the corpora cavernosa or the penile. So there is structural and functional, disturbance in the patients with diabetes and. Let me give you a deeper perspective. You heard about endothelial dysfunction, right? Now, what is more recent studies at the level, at the islet beta cell level? There is acute insulin release, which is regulated by the mitochondrial ATP production and mitochondrial reactive oxygen. Now, these may contribute to a long-term deterioration of insulin secretory capacities in type 2 diabetes. See, they all diabetics say, I'm tired, thak jata hu, I feel fatigue. They're not telling a lie. No, it is the ATP production which is gone due to mitochondria being affected. Mitochondrial function is very critical determinant of insulin sensitivity within the muscle, liver, and adipose tissues. Okay. So in persons with type 2 diabetes, the high nutrient influx and consequent production of reactive oxygen species appear to mediate a loss of beta cell function. In insulin-sensitive tissues such as liver, muscle, heart, fatty acid influx leads to oxidative growth. At the same time, non-insulin sensitive tissues, which include eye, kidney, nervous system, and penile vasculature, are exposed to both high circulating glucose and fatty acid, and consequently ROS-induced diabetic complications. So please remember, it is not just the endothelium in diabetics which gets damaged. It is even the mitochondria. So a lot of mechanisms which are there. I will not go into the details about it, but enough to say that diabetes-induced erectile dysfunction is not just endothelial dysfunction, for which you can take PD5 inhibitors or many other things which I'm going to tell you later on, testosterone, etc. But also need to remember that you need to correct your mitochondrial dysfunction also. So both lead to emotional dysfunctions because you live a sex-starved life. Now, we also know that erectile dysfunction is nothing but subclinical cardiovascular disease. A person who has erectile dysfunction, after 3 to 5 to 7 years, he's going to definitely develop cardiovascular coronary artery disease. This is proven beyond doubt. So if you are having erectile dysfunction, or if having at the early age of 30, 40, if you have a family history of diabetes or hypertension or dyslipidemia, you need to do something to retard the onset of critical events like myocardial infarction or stroke in your life by modifying your lifestyle, by taking all the necessary things which you need to take during and reverse or remit whatever are the metabolic syndrome you have. So we do a lot of tests besides the metabolic screening test. You also can do sugars, lipids, do for testosterone free total sex hormone binding globulin, thyroid, FSH, LH, prolactin, do your vitamin D levels, even uric acid levels have been said because most of you have hypertension, you are taking diuretics, you have a lot of uric acid. So sonography of the scrotum, Doppler studies, serum PSA. If you have to give testosterone, you need to monitor PSA, digital rectal examination, and 3G scan. So how do we treat? We have the first line of therapy. You can take low dose of PD5 inhibitors. If they don't work, you can take injection of papaverine, vacuum therapy if you don't want to take any drugs or injections, or if you are very allergic to something or you have some side effects, you can take vacuum therapy, intravenous. Now, all these fails, you need to go to a surgeon for penile implants. But all said and done, counseling and lifestyle measures you have to follow for your lifetime. I'm again reinforcing it that just counseling, you got to get it done, and lifestyle modification will definitely help you in long run. It has been said in 2018 revision of process of care that lifestyle changes may be accomplished by the first line medical therapies in treating all these disorders. Low dose PD5 inhibitors for 12 weeks, say 5 mg or 2.5 mg, you can give to your patients, irrespective of whatever be is HbA1c or hypertension or prostatic hypertrophy or dyslipidemia. They have been shown to produce very good results. Because what happens is, now tadalafil is known to be 80% concentrated in the cells, only 20%. So if you give low dose of tadalafil, you will not have the side effects of an adult dose of total dose of tadalafil. But over a period of time, say after 7 or 8 years, there'll be so much of tadalafil in the cellular at the cellular level that it will have an effect of an adult dose or a normal dose of. So low dose tadalafil is definitely beneficial to your patients, which is I just explained to you. My friend Dr. Jyoti Dev uses insulin pump. You can take insulin pump, nothing wrong with that. And it has shown to improve sexual functions to about 83% and quality of life definitely improve in Indian pop. This is an Indian population study. Okay. There are a lot of novel treatments like low intensity extracorporeal shockwave therapy, PRP, which we are doing. We are doing the first research in India at Wardha Medical College, which will be published soon, shown to have some good results, some promise. But low intensity extracorporeal shockwave therapy we don't have enough evidence. It's very expensive, but very effective for early or mild to moderate, not severe erectile dysfunction. So we have been treating erectile dysfunction for donkey's years, but none of these therapies, however, reverse the pathophysiology of erections. We know it is endothelial dysfunction and mitochondrial dysfunction. None of these therapy, whether it is Viagra, Levitra, Stendra, Kevajet, News, none of them improve the endothelium, nor they improve the mitochondria. Diet, herbs, and there's a very good friendship between these things. The polyphenols, ACE inhibitors, adenosine deaminase, all these are associated with erectile. By modulating or altering the activity of these physiologically important enzymes, there are various bioactive compounds which are from plants. We have fenugreek, which has got a chemical composition like testosterone. I'm scared to give testosterone to younger patients because they may develop azoospermia. I'm very scared to give testosterone to older patients because they may develop heart failure or prostatic issues. So I give them fenugreek in a saponized form, which increases the free testosterone in these patients. There have been enough studies to prove. So these patients develop desire, which is the first thing. And then we can give them something to increase the nitric oxide like L-arginine, which can definitely help in the erectogenic mechanism. And with these two things, we can treat our patients and without giving them any side effects or complications. L-arginine is known to modulate the glucose and lipid metabolism in obesity. Postprandial hypoglycemic activity of fenugreek studies have been studied in type 2 diabetes very well. And there is a new drug called avanafil. The beauty of this drug is, I will advise all diabetics can take this, even if you have a cardiovascular disease, even if you are on nitrates, which is the contraindication of other PD5 inhibitors. Now, why I say this is because the onset of this drug, action of this drug is 15 minutes. You take it at 9 o'clock, 9:15, you are ready. It has got very less side effects of headache, myalgia, bluish greenish discoloration, what you normally see. And the beauty of this drug is that it's washed out from your body within 5 hours. So half-life is just 5 hours. So suppose you are taking nitrates and you can't take sildenafil equals contraindicated, can't take tadalafil, can't take avanafil, can't take udanafil or what. But avanafil, you can take it. Why? Because if you have to have sex with and by taking avanafil, you need to skip your nitrates on that day and take avanafil. Once you take avanafil, you are ready, have your intercourse, etc. And after 5 hours, this drug gets washed out. And next day, again, you can start your nitrates. So this is the only drug which you can take as PD5 inhibitors to have a good sexual relationship and not affect your treatment with nitrates. Now, let me give you the last part of my talk, which is the ethical perspective of it. See, we all are aging. Aging is not a disease. Aging is nothing but you are in a pro-inflammatory status. Anything can trigger and you can become this thing. Now, aging and cardiovascular disease risk factor. See, there is something called as sirtuin. Sirtuin are in anti-aging genes which are present in our body. Sirtuin 1, 2, 3, 5. So if you restrict your calories, you through various mechanisms initiate sirtuin formations. You activate the sirtuin genes, which ultimately increases your lifespan. So if you want to live longer, live healthy, live with normal endothelium, live with normal mitochondria, you need to activate sirtuins. Now, the only thing which you can activate sirtuin is by caloric restrictions. This is the first thing. So caloric restriction is very, very important for every one of us who want to have a normal endothelium. Now, a beautiful research done by my teacher Yoshinori Oshumi, who said that you can activate autophagy. Now, auto means self, phagy means cleaning. Now, your body has a capacity to clean the garbage which is present in every cell of your body. Now, if you have a house which is neat and clean, every day it is clean, it's vibrant, it's nice, it's positive. So similarly, we have in our body a mechanism where all the cellular garbage can be cleaned out. Now, this can be initiated after 12 to 18 hours of fasting. So autophagy is a second very good phenomenon which has been proven that it can increase the health of your endothelium and mitochondria by cleaning up all the cellular garbage which is there in your body. Now, it has also been studied in diabetes. The liraglutide ameliorates erectile dysfunction by regulating oxidative stress, Roy-Rock pathway, and autophagy in diabetics. So beautiful studies have been shown that autophagy, sirtuin, and the third one, which I'll just tell you, these three are very important, not only for your sexual fitness, but also for your longevity. So sex, now third aspect which I want to say is hormesis. Now what is hormesis? You need to stress your body to a little more than normal. I give a very simple example. Say you want to go for a bath, you take a hot water bath. But on one day, take a little more hot water. The temperature of the water could be little more. So you'll feel a different, it should not be very, very hot so that you burn yourself, not to that extent, but more hotter than what you normally take. You take a shower with that bath, and after half of shower, take a very chilled water bath. So this is, adaptive response to various stresses of your body. If you do this on a long term, again, you will find your hormones, your endothelium, your mitochondria, everything will become fine. And this is known as hormesis. It has been proven beyond doubt. Now, PD5 inhibitors, I call them, they are the nitrates of the penis. What they do is they dilate the whole penile vasculature. Also been studied that PD5 inhibitors produce PKG1 alpha. When PKG1 alpha is produced, there is increase in the antioxidant enzyme. So in diabetics, low dose PD5 inhibitors will produce a lot of antioxidant enzymes, which will reduce the reactive oxygen species and improve the mitochondrial health, and of course, definitely improve your cardiovascular functions. So, empagliflozin, SGLT2 inhibitors, we have done. Even what SGLT do? They reduce the weight, they control hyperglycemia, they got a lot of other benefits. So, all the vasculogenic causes of erectile dysfunctions are taken care of, along with metformin. Metformin also now have been studied and proven that it improves the endothelial health. So if you combine metformin and SGLT2 inhibitors, you will find improvement in the sexual functions, and these patients don't need additional dose of PD5 inhibitors. So the pill burden is reduced. Not only the pill burden, diabetics are not affected with taking a lot. They as such are taking a lot of pills, but the feeling that the impact on their mind that they have to take a tablet to get an erection for having sex, that is reduced. Imeglimin, wonderful drug. It restores the normal mitochondria. See, imeglimin improves, it reduces the ischemia, infarct size, improves left ventricle, and also improves erectile functions. Imeglimin is available to us. It's not expensive. It's very good. So you can give your patients SGLT2 inhibitors, metformin, imeglimin. You can give them. So everything can become fine, or you can take it. We can reverse the endothelial dysfunction. My teacher, late Dr. R.D. Lele, proved long time back, showed several successful strategies to reverse the endothelium. PPAR alpha gamma agonist and vitamin E, vitamin C, L-arginine, tetrahydrobiotin, cypiaptrin, SOD mimetic temples, statins. So there are so many pharmacological remedies also available to us to improve our endothelium. So we can try this. See, ACE inhibitors, statins, insulin sensitizers, L-arginine, folates, tetrahydrobiotin, all these things restore the endothelial function and protect you from peripheral vascular disease, stroke, heart disease, diabetes, insulin, chronic kidney disease, tumor, etc. Type 2 diabetes remission is not a myth, it's a reality. My friend Dr. Paresh Dandona treated diabetics with testosterone for 23 months, and he found improvement not only in the sexual function, also in the insulin sensitivity. Dean Ornish, long time back, proved that intensive lifestyle will reverse your coronary artery disease. Even Cleveland Clinic, in their original research, such a huge plaque, with just nutritional interventions, no drugs, no stenting, only with nutrition, this huge plaque was opened up. So they said nutritional intervention in their study has halted and even reversed the coronary. So you have so much of evidence available to us that what nutrition can play, what good, beautiful drugs can do to us. The best diet, my favorite man, Dr. David Sinclair from Harvard University, he said you take as breakfast a bit of yogurt with plant-derived polyphenolic molecules like resveratrol, even red-colored grapes have resveratrol, drinks of 1 or 2 green matcha teas, and plenty of water throughout the day, along with plant-based food should be your main diet. In these supplements, vitamin D, vitamin K2, resveratrol, quercetin, nicotinamide mononucleotide, spermidine, trimethane glycine or betaine, and metformin. These are the best thing to increase. You will increase in your chronological age, but your biological age will reverse if you take this diet. It's been proven beyond that. Dr. David Sinclair is a very big scientist and a genetist at Harvard. Lifestyle, you may be Hindu, Muslim, Sikh, whatever, but make lifestyle as your first religion. Because not only your pro-inflammatory milieu, which will reduce, insulin resistance will reduce, oxidative stress will go away, endothelial functions will improve, and you have improved well-being and reduced burden of sexual dysfunctions. So the art and science, my last few slides, the art and science of sexual fitness of doctors is based upon what doctors put in their body and what they do with them. These are the only two things which we need to understand. What you put in your body. तुम कचरा डालेगा तो what will happen? And you will do something rubbish. You'll sleep for 10 hours, or you won't sleep for 2 hours, or you will do something rubbish with your body. These are the things. Irving Wallace, who wrote 7 elements. I'm going to give you 7 elements which are the best for the sexual fitness. First is the diet. Red colored fruits and vegetables, all green vegetables, dark chocolates. My teacher, Dr. R.D. Lele, said 400 grams of fresh fruits, 112 grams of cow's ghee, bitter gourd, and 45 minutes of walk, and a balanced diet. Cut down on, see, don't give them a prescription. 8 baje ye khao, 9 o'clock eat this, 10 o'clock don't eat this, 11 o'clock. Nobody can adhere to any prescribed diet for a long time. So just tell your patients, cut down on SOS. Now, what is SOS? Salt, oil, and sugar. I tell my doctor friends, if you are taking more of papad, chutney, achar, you're increasing your blood pressure. You will need medicines for lifetime. You will have sexual dysfunction, and it will be a killer. You know it. You are a doctor. If you increase your oil, you will have dyslipidemia. You will need statins for lifetime. You will get sexual dysfunction. And again, it's a killer. You take a lot of sugar in spite of you having diabetes. You will get sexual dysfunction. You will need insulin. You may need pumps. You may need so many things. And of course, it's a killer and with sexual. So just give them a blanket thing that cut down on SOS, which is your stomach is not a waste bag. Come khao, gum khao. And medications. If you are giving your patients hypertension, or if you are taking if you have to take beta blocker, take nebivolol. If you have to take diuretic, take indapamide. Otherwise, ARBs are the best for it. Avoid tranquilizers, excess of pan 40 and all. Antihistamines will dry up. Women have allergies, they take antihistamines for a very long time. So they have painful, intercourse and all. Anxiolytics, antidepressants. 5 to 10 mg of tadalafil, as I've already told you. Workout, very important. A lot of yogas are there. Sitting is sleep. Now, if you deprived of sleep, the sizes of the testes have been reduced. We have done this study with the help of orchidometer. Patients who had less sleep, and doctors are sleep deprived. So the volume of the test, the volume of any organ reducing, the functions of it reduces. It's very obvious. So you need to sleep for 6 to 8 hours. Reduce your stress in whatever way you can. Supplement with whatever. L-arginine is a must for you. L-arginine got Nobel Prize. There were 3 of them who got Nobel Prize for this. Stimulate yourself sensually. Be positive. Enjoy your life. You're not going to get these moments again. So stimulate her senses. If your partner is used, so many patients, doctors come, "Arey, mere ko to hota hai sahab, usko interest nahi." You have to stimulate her senses. That's very important. And what is the best time of the day to have sex? See, we all work. Sometimes we work till late night. So the best time for having sex is between 5 a.m. and wake and quake. So morning, you wake up and you do it. That's the best time. We call it Gwala shot morning because that's testosterone time. That's heavy time. The best time, according to the studies, is 5:48 a.m. You get maximum pleasure. So 5:45 is the best time you can have sex. Now, PD5 inhibitors, we know a lot of side effects, contraindications. So the onus of sexual fitness lies with you doctors yourself. You know what is lifestyle modification. You know what to do for it and how to put it. There is less romance in doctors, which I see amongst themselves. If your partner is also a doctor, there is no romance at all. You need to hug. You need to increase your romance. There is no GST. You got to, even if you are a doctor, even if your partner is a doctor, you can ask her how did she spend her time. You don't have to answer back. Everybody needs an ear, emphatic ear. Everybody needs it. You need to listen to your partner. Some doctors suffer from early reject. I don't call it a disease. It's the most common problem which every man has. It's more common than common cold. There are no tests for this. There are a lot of beautiful exercises which I can teach you all. You can take depoxetin, 30 to 60 milligram, 1 to 3 hours before section, not to take it every day because it's addictive. So this is an SSRI. This can produce erectile dysfunction, but it's a very good if you take it on schedule once at a time, but not to take it with alcohol. even tramadol has been shown to increase the ejaculation time by at least more than 2 minutes. In female doctors, they have a lot of issues with orgasm, with pain, with vaginismus. So pharmacological treatment, definitely there is the cognitive behavioral therapy, remove the risk factors, sex therapy, and so many pharmacological agents are there like estrogen, testosterone, tibolone, PD5 inhibitors, fibronacin, Botox can be given for vaginismus, a lot of herbal things. But what I give to my lady doctors who have issues with desire, I give them testosterone gel to be applied on non-hairy parts and PD5 inhibitors, maybe low dose, 50 mg of sildenafil works very well. But DHEA is a fantastic drug which I give them. I don't use this drug flibanserin, which is an imported drug, very expensive and no effect at all. So my take-home message is sexual dysfunctions are not uncommon, hence not an option. It's not an option for any doctor. Any doctor who's stressed, who has these metabolic things can get it. It is how gracefully we handle the process and how lucky we are as the process handles us. So we have all PD5 inhibitors. Please remember, they will not increase your desire. 40 to 50% of our patients are not responding. So even if you take in, don't respond, please understand, yes, it's possible. They don't respond. So we rush to testosterone. Yes, but we got to give it with caution. You can't give it to younger people. You can't give it to older people for various. So who's the Raja of all? L-arginine, fenugreek, regenerative medicines, and of course, lifestyle modifications. So bank on these things, please. You will not only remit your diabetes, hypertension, obesity, dyslipidemia, and of course, regain your sex life back. So today we have got so many things to give to our patients with sexual dysfunctions that these functions can be normal. An ideal prescription for a diabetic, if you are giving or if you're just get counsel on lifestyle modifications, and you can give whatever OHA, but according to me, metformin, SGLT2 inhibitor, and imiglimin is a must. Statins if you have dyslipidemia. ACE inhibitors or ARBs are okay. If you have to give beta blockers, don't give them atenolol and all those propranolol. Just give them nebuvolol because that's sex positive. It increases the nitric oxide. Indapamide has got less uric acid distincts. Low dose PD5 inhibitor. If there are no contract, if he's on any Imdur or glyceryl trinitrate, please don't give them. Low dose testosterone if no contraindication, and monitor PSA. For a short time, you can give test. L-arginine supplement with fenugreek, nutritional intervention, of course, get yourself. The secret of sexual happiness, friends, very important aspect of my talk. The secret is understanding that sexuality, our sexuality, is ever evolving. It changes. What was feeling good at one time may not feel good at the other time. Our desire may be high, may be low, but not the same at all the times within relationship or within ourselves. We must reclaim pleasure. Pleasure is your right. And the power to give pleasure is the greatest power we humans have. We can give pleasure to our partners can give pleasure to us. That is the biggest power. We don't have to search outside, we don't have to buy pleasure outside. So we need to have an attitude shift, and this is the choice we all have. We doctors should come out of ego. Ego is the biggest mistake of life in any relationship. We need to come out of these things. We need to forget that there is something called as ego. You need to say sorry. You need to just patch up as early as possible for whatever misunderstandings you have. See, 2 times Nobel Prize winner, Dr. Linus Pauling, when he received his second Nobel Prize, such a brilliant man, who will get 2 Nobel Prizes? This man got it. And he said, nearly all disease can be traced to a nutritional deficiency. What else you want? You are a doctor. Many times, we doctors don't feel like taking medicines. So if we are of that mindset, we need to cover up ourselves, our problems with correcting our nutrition, which is very simple. We have evidences. We are all knowing about the science behind what is good nutrition. So such a good message Dr. Linus Pauling has given to the world. We go in for angioplasties and this and that. Food isn't like medicine. It is medicine. This is what you should remember. So it's really nice to know that if you diagnose ED earlier, you can retard the onset of critical events. So it's a blessing in disguise. Reversal of metabolic syndrome, lifestyle modification, and with L-arginine, erectile dysfunctions can be a correctile dysfunctions. So a tragedy can be converted into a bliss. So you need to respect your body. All male doctors, please learn to respect your body. She's given you everything. She's given you your family, your children. She's been a homemaker, everything. So you need to respect, trust, admire, and adore your partner, which is very important. If you have problems, you can send your patients or you can treat it yourself. Don't send them to quacks. Usse pungi bajayega, nothing. Just treat yourself. It's very simple. Treat yourself also for your own problem. Just take a load. You can consult anybody. If not, you can talk to me. I can see that you get a better. So this is my book, Sex Has No Expiry Date. My last slide. Physicians are not spared of sexual dysfunctions. Lifestyle modification is a must for lifetime, not only for some time, but for lifetime. Diabetes is a sexual health tsunami of our century. Erectile dysfunction is prevalent and the earliest marker of coronary artery disease. Those PD5 inhibitors are effective. Low dose PD5 inhibitors, statins can be ideal choice. Short course of testosterone can be given with cautions. L-arginine supplement and fenugreek are a boon. Activates sirtuin's autophagy and hormesis by caloric restrictions, just by caloric restrictions. Eat less often. Eat less often. That's very important. Diabetes remission is a fact and not a myth. Erectile dysfunction is a correctile dysfunction. And if you do so, sex really has no expiry date for all doctors, for all your patients also. Thank you very much for your love. I'll be happy to answer any questions you all have.
Thank you, Dr. Deepak. Wonderful talk, as always. But as today's session was dedicated to doctors and physicians, and you said in your last slide that physicians are not spared, they are also having these kinds of problems which are usually seen in the common person. So how many, as you are practicing sexology, how many physicians or how many doctors you see in your
40%.
practice?
Anuj bhai, 40% of my patients are doctors.
Oh, and they are really disclosing their problems?
Yes. Once, see, every conference I attend, I get calls. 3 to 4 calls from each doctors. I treat them, no problems, and they are very happy.
And another
Because
important thing, yes.
when they listen, they open up. You need to talk. You need to just discuss about it. Unless you don't talk about it, how? And when they know that there is a treatment, and today everything can be managed. I've proven to you, just with nutrition and simple drugs, you can manage every sexual dysfunction. So if you have a solution, you need to work on it. Nothing difficult. Aren't we treating our patients for so many complications and so many things? So think yourself to be a patient. If you have some issue, and take the treatment for it. And it's ethical. It's evidence based. I'm not telling anything which is off the hat. It's with evidences. I'm telling.
Yes, you are not telling anything which may not be known to the doctors. They may be knowing all these solutions on themselves. But multiple times I think most of the doctors also know about the side effects and adverse effects of the medication. So they don't go for that. And many a times they don't really understand that they are the right candidate for this medication if they should take it, or they are really having this problem, because multiple times we see that in our study days we keep on doing the 15 years studies, and those studies are also very busy schedule, keep on busy in the night shift, keep on busy in the day shift. Hardly we get enough time to partner, and hardly we can spare enough time, any time to our friends or partners or whosoever it may be, if the marriage has not happened, or if the marriage has happened, still we don't get enough time. And once we come into the profession, early career physician has to make themselves, they have to establish themselves, and for that reason they have to run from one hospital to another hospital, one clinic to another clinic, and having a lot of stress also that today the patient has come little lesser yesterday, what will happen tomorrow, and a lot of things are always coming up in the mind whenever we are beginning in the beginning of our profession. And this is the time when we are having the maximum requirement of the sex, or we can, anybody has the maximum potential to sex, and the age in which a person has the maximum potential to sex, it goes in vain with all these issues. So what is your suggestion to the upcoming doctors or the doctors those who are still in their medical schools and completing?
Very, very,
How
very
should-
important aspect. Very important aspect of every doctor's life. Anuj, please understand. Okay, you are scared of the side effect. You heard that, oh, aisa hota hai, waisa hota. At least nutrition, you are not having any complications. At least the guidance on good nutrition, you can have it to keep yourself, away from all the toxic effects of excess of food, excess of smoking, alcohol, etc. So that does not have any side effects, right? So at least we understand that. And if you're scared, see, our allopathy, every medicine which we take comes with a baggage of side effects, which we all know about. None of the medicines are absolutely clean shit like no. So the benefit which is there is to be judged. Okay, there will be side effect. If you take sildenafil, you might get slight headache, but okay, that will go away once it's washed out from your body. Okay, so but you are having good enough sex. For this headache, you can take something. We can give you something additionally so that your headache is gone. So there is a thing. And second thing, younger age people, I would advise them to have a good lifestyle. Sleep 6 to 8 hours. Don't be in the rat race. Don't be in the rat race. Don't get burnt out. Don't get stressed. My teacher tells me, दीपक जो होने वाला साला होके रहता, तू और मैं एक झाड़ का पत्ता नहीं हिला सकता. So whatever has to happen will happen. Accept and adapt. That should be your principle in life. So work hard. I don't say, but not like mad. You starting your clinic at 7 in the morning, then you working again in the evening till 12 in the night. That's not correct. See, that affects your longevity. That is definitely going to put you to stress. And today, see, we have come to know about stress now. 20, 25 years, we never heard about stress. But stress is there. Our children are paying capitation fees and getting into medicine, spending crores of rupees. Then they have to work hard. They have to do something which is not correct. So we need to evaluate our own self. We have a proper mindset, have a proper attitude towards what we are doing, and always think of one thing which I feel these youngsters should do is they should not harm their patients. Primum non nocere. If they are ethically practicing in a nice way, explaining, counseling their patients, giving them time, their future is very bright. They will cover up whatever money they have spent easily in their life.
Yeah, before I come back to you, I must request my colleague, Dr. Rajat Tiwari, to give his opinion and will come with some issues if he's
Yeah.
having in his mind.
Thank you, sir. And it was a wonderful talk as usual. We have heard you a lot of times. But the problem with the young doctors is there is a twofold problem. Basically, discussing sex, that's a big taboo in our society. And for a youngster who is already overburdened, as Dr. Maheshwari sir has already said, where should he talk? Because the doctors are very lonely people. They usually even don't talk with their spouses as regards to these issues. So, what should be our ideal sounding board, and how we can make a good communication? Because I think it's all about talking also. Because if we give them a lot of good advice, we can at least help them to solve their problems. So that is the point. Which should be the first sounding board for them. So this is my question to you.
Yeah. Very good question. See, Dr. Ajay, how long are we going to continue the taboo of this? How long? Do you want to still continue for another 10, 20, 30, 40 years? Or we need to break this ice? We are all born out of love and sex. Why are we shying out of talking about it? We talk about piles, we talk about fissures, we talk about cancers, we talk about every damn disease, dirty skin disease, warts, papillomas, everything. But we don't talk. The onus is with we physicians. We physicians should come out of our clinical inertia and ask our patients in the regular history as a definite question in a very emphatic, soft tone. Do you have problems in making love? to a patient who's 30 years old and above and having a strong family history of metabolic syndrome, or who's a smoker, or who's watching a lot of porn, or who's a drug addict, or who's taking a lot of alcohol. These are the category of patients whom they should definitely ask this. You will be surprised, Dr. Ajay, that if you talk to your patients and tell them that अगर आपको ऐसा कुछ है, क्योंकि डायबिटीज में ऐसे होता है, जिनको फैमिली हिस्ट्री है उनको भी ऐसे होता है, बट आज उसका बहुत अच्छा इलाज है. He may not answer you at that time. He may not, tell you that he has this problem, but he will remember it. And next time when he come and he'll tell you, डॉक्टर साहब लास्ट टाइम आपने मुझे जो पूछा ना, मुझे लगता है थोड़ा थोड़ा मुझे ऐसा प्रॉब्लम है. See, he will open up. And this is our duty. Parents, teachers, and doctors. This we need to do it. And this is my mission. My mission is that our generation, we have suffered. Our generation, next generation shouldn't suffer from sexual dysfunctions. Because everyone's pleasure is their right, it is their business. So we need to break this ice. We need not extend the taboo another 10, 20 years. Why? What is the shyness in talking about it? Please make it a habit in your whatever small history you are taking. If you get a patient who's a diabetic, having 30 years old, or you find, just ask him, do you have problems in making love? होता है, ऐसा भी होता है, लेकिन इसका आजकल बहुत अच्छा इलाज है. It can be managed. Tell him in a very soft manner while you're examining him. उधर सब ठीक है ना, सब अच्छा है ना, सब. Like that you talk to him, nothing wrong. So many of my GP friends have started asking and they're very happy. Nothing wrong. Patients come out of it. Patients tell. Today, women are more proactive. It's gone those days when women were tight-lipped, they were never talking about it. We have wives bringing their husbands. Because see, today, previously what used to happen, Dr. Ajay, that we used to get our daughters married in a house where ladka khate peete ghar ka hai, paise se acha hai, sab kuch. So that was the criteria, financial security was a criteria. But today women are empowered, they're earning more and equal to men. They're bothered about their financial security. No, they are earning enough. So what else they want if they don't want financial security? What else will a woman want? She's got her own job, own money, own car, own house. So what she's expecting is sex, compatibility, trust, understanding, companionship. So this is what is the change which we are seeing. So women are more proactive and bringing their husbands for the issues with them. Husbands are not talking about it. They have ED, they have early ejaculations, they keep quiet, they develop an avoidant behavior. They deprive their partners of, their partners don't have any issues. They're depriving them of the sexual pleasure which they deserve. And this is one of the reasons why they drift. There is extramarital affairs, infidelity. This is what is the common reason. So we need to, onus is on us. We as good ethical physicians should think, अरे ये 30 years old है, इसके father को diabetes, इसको कुछ होगा, पूछ के देखने में क्या जाए? Just ask. Keep this in your mind. This can be your last question to your patients in a very simple, soft tone. Unless you ask, he is not going to come out. His wife may come after some time, but he will not.
Actually, sir, we are interested to empower our young physicians for this. So my question was, how a physician, because usually if you see in the practice, everyone is burdened and is running from here and there and visiting so many hospitals. So if we come to a patient, we definitely can ask them and we can inquire from them. How a physician should communicate? Can we facilitate them? Can we have an anonymous board where they can put in their questions? Something like that. Because usually if you see a doctor is very aware to going to a different doctor for his problems. So basically, can our chapter, American College of Physicians, and our well-being lounge can devise a strategy that these early career physicians who are really hard pressed because of their various issues. So can we evolve a sounding board?
We can definitely do that, Ajay bhai. What we can do is, we can have a set of certain questions, which they can easily ask, and we can train them on these skills of how to ask these young physicians. How we seniors talk to our patients, that's very effective. The same way we can ask our junior doctors, young doctors, to and motivate them to go ahead and ask in this fashion. We can increase their skills of talking to the patients, how to communicate on these aspects, how to be emphatic, how to be very soft, how to be effective, and when to talk, with in front of whom to talk, how to manage. These are the skills, soft skills, which every young doctor, if he adapts, learns, practices, I'm sure that this sex will not remain a taboo for a long time. That's the only way. You can't have a polling booth or anything. You have to talk. Kya ho gaya? Nothing wrong. I get lesbians, I get homosexuals, I get transgenders. I don't feel bad about it. That's their life. Everyone's pleasure is his right or her right, his business. I'm concerned with making them good, compatible, having issues amongst themselves, solve it.
Dr. Deepak, in young age or in early career, our clinicians brothers or we were running from here and there. We were not having enough time for the erection. After the 60 years of the age, when we become the advanced career physician, then erection doesn't happen. So when should a person enjoy the sex and when should he satisfy the sexual
Anuj bhai,
pleasure?
please remember, sex has no expiry date. From 9 years to 90 years, a man can have sex. Whatever be your issues, whatever be the cause of any sexual dysfunction, any doctor or any man has, these are all manageable. In fact, I feel post-menopausal period, after the age of 50, 60, when you're retired, your struggles of life are over. Your children are settled, you are settled, you got house, you got everything. So you got more time to experience and experiment. That's the golden period. I find this is the golden period. Schedule half a day for this. Nothing wrong. So make it a priority in such a way that you will really enjoy. You will enjoy more than what you enjoyed when you were 20, 30.
But by that
Because
time,
now
many
you
a
are
time,
at peace. She's not bothered about the pregnancy, menstruation, children, etc. and all that. And you're not bothered. घर अच्छा है, खाते पीते हैं, सब कुछ है. Our businesses are running, everything is okay. So you are at peace. You were not at peace when you were 30. You were struggling. You were running here and there. And you forgot in the rat race. You forgot that you also have a sex life. So this is the golden period. Make the best of it. Nothing wrong in that.
One more thing comes in my mind that we, the senior clinicians, start sharing our experiences with our juniors, with our young buds who are coming up, and instead of making it taboo, because they may be shying to telling their problem with us, but we can ourselves tell them what should they do and how they are doing, and we can break the taboo from our side. And
That's
that
what
could
I
be
just
a
told.
better
That's
idea.
what I just told,
Yes.
Anuj bhai.
Obviously, I'm
See, you're
taking
getting
from
a patient who's 30-year-old, as a father who's diabetic, as a mother who's diabetic. Tell him that diabetes में ऐसा होता है, सबको होता है, लेकिन इसका आजकल बहुत अच्छा इलाज है. But tell this much only, enough. And this will trigger in his mind, oh, he could not have sex last night, he had ED, could not get erections. So he may not talk to you at that time, but next time when he comes to you, or he may come soon to you and tell you about this.
But nowadays we see that a lot of people, those who are not having diabetes, even if they are having this kind of a problem, they might not have enjoyed sex last 6 months or 1 year living
See,
together.
the reason is very common. Today everybody is marrying at a later age. Nobody is marrying like how we married at 22. I married at 22. So nobody is marrying at that early. Now what happens is these youngsters watch a lot of porn. Okay. before they've had sex, before they've got married, they have watching a lot of porn. So when they watch porn, the images and the videos which they see arouses them and they masturbate. In fact, they are having sex with the images and videos. Correct. Over a period of time, they get fed up with those normal type of porn. Then they see more aggressive porn. They get fed up in the sense they don't get erections with the normal porn. Then they watch more of aggressive porn. Now, when they watch more of aggressive porn, they do get arousals, they do masturbate. So the things don't end here. Now, their arousal or erection is dependent on the aggression which they see in the movies, which is a total lie. And when they get married, that scenario is not there in their bedrooms. They don't get erections. So that the wife feels, Arey, what is this? I married him, and on the day of my marriage, he's not getting. Again, they went to honeymoon, they didn't get erections. So this is the increased, tension in the wife. And today, there's no shame. There is nothing like a shameful thing to get divorced. It's not disgraceful to have a divorce. ये कुछ कर नहीं सकता, अभी नहीं कर सकता तो बाद में क्या करेगा? This is what they say. So porn-induced sexual dysfunctions are very, very common in younger people. And most of these younger people who got freedom, they have their cars, they smoke, they drink, they take drugs. So what will all these happen do to them? Are they going to increase their sex power? No. So this is one common reason why younger adolescents are having sexual dysfunctions.
Sir, our talk has caused a lot of flutter in some of the social groups, and one of the most prestigious one is the CME group. And the admin, Dr. N.K. Singh, has asked that do you have some studies to corroborate that the best time to have sex is 5:45,
Yes,
5:48
yes,
a.m.
we have.
So he has asked,
I
and
can
he
send it
has
to him. I
asked
can
me
send
to
it to him.
yes,
I'll send it to him. He's a good friend of mine.
yeah. So
See,
he asked me that you
see
ask
the
him because
logic.
he's in a
Testosterone production is highest at that time. And if you look at the male sexual response, which begins with the desire, which is dependent on the testosterone. So the foundation is testosterone, leads to arousal, ejaculation, and resolution. So if you're at that time, again, you are rested. आप भले 11 बजे 10 बजे 12 बजे सोए हो, आप सुबह 6 बजे तो rested ही होगे ना. You're not coming out from your operation theater or from your clinic after seeing 100 patients. You're not that fatigued or that tired. You rested, you had a very good sleep, your testosterone is high. That's the best time to have it. And when you get up from sleep, the parasympathetic activity is more, which leads to erections also. You get a better erections. I will send him that paper. A lot of studies are there.
Thank you, sir. And he was in a Vijayadashmi celebration, and he had texted me from there. You ask him on my behalf. So that means that's going in a big way all around the world.
Hey, it's a fact. We call it Gwala shot.
Dr. Jumani, we had seen a lot of these problems with doctors, as you said, that 40% patients are with the doctor. Do we have ever any kind of a study or any observation why doctors are only, why not the other professional?
All
And
professions have it, Manoj bhai. All of them
40%
have it. Even
40%
professors,
share
even
is only of the
engineers,
doctors, and
engineers,
rest all
every
are
business.
coming in remaining 60%.
All class of patients have these issues who are aging. Anybody above 30 who has a bad lifestyle is going to have these issues.
Yes.
This is a bigger pandemic than COVID.
One very important thing you said in your presentation, what you put in your body, that decides how much your sexual
And what you
life
do with your
is going
body
to
and
be.
what you do with your body.
What you do with your body and what you put in your body.
Simple.
Both are things. So
Tell me the third reason for you falling sick.
Yeah, what do you suggest to our clinician brothers, to our doctors? What should they put in their body and what should they do with their body?
Lifestyle modifications, plant-based food first. Drink a lot of water. Okay. Eat less often. Sleep for 6 to 8 hours a day. Work for 30 to 50 minutes, 30 minutes per day, 5 times a week. Do not get stressed. Remember one thing, जो होता है साला होके रहेगा. Accept and adapt. You and I cannot change anything on this earth. Accept and adapt is the best thing. Don't and have good social family ties. And don't have any egos. Egos is the biggest mistake of life. Majority of the problems are because of ego and misunderstandings. I don't mind saying sorry to a small student of mine. My PhD will not go away if I say sorry. Mera baal bhi baaka nahi. If I say sorry, I am not wrong. Even if he is wrong, I say sorry. Okay, I hurt you. Sorry. I want relationships to be maintained. I don't want any peaceless mind. At the end of our life, what do we need, Anuj bhai? We need job satisfaction and peace. That is all we want. What are we going to carry with us? So we need to have no ego. We need to be egoless. That's what is the main thing of life. And be good, do good, eat right, eat on time, sleep well. My friend, my teacher, Dr. Sashank says this.
We talked a lot about the erection problem. So once we talk about the erection, we talk about the only the 50% of the population. Remaining 50% is still unattended. So what do you say that when a female is not taking interest in the sex, when a female is not having the adequate sex desire, so what should we find the solution?
70 to 80% issue lies with the men of those wives. If he has a issue, say ED or early ejaculation, he doesn't take treatment. He's shy. He feels that he'll be judged upon. He dominates over her and he doesn't have sex because he is got problem. He doesn't want to get confronted again. कि अभी करूंगा वापस मुझे नहीं हुआ तो what she will think about me. So there is a gap. And one simple logic is, Anuj bhai, that if you want to become good in anything what you want to do, if you want to become an expert, say this is a mobile, I want to become an expert in repairing the mobile. If I repair one, okay. If I repair 100, I'll become an expert. So by doing it more and more, I'll become more expert, not by avoiding it. But they develop avoidant behavior. And that's the reason and today, most women, of course, things are changing. They accept what the husband says. ठीक है यार, बोलता नहीं करता नहीं करता. So being asexual for a long time sets in depression in them. So they don't have the desire.
Is there any lack of
And
desire?
they don't need antidepressants. We have treated these women with bridging the gap between by making the man all right.
Many times we see that some people complains about the postmenopausal life brings some distaste in the sex or lack in the sexual desire. How much it is correct?
It is correct. See, when menopause sets in, there is zero estrogen in them. Okay. So they have less lubrication, dryness. Okay. These two things, when the vagina is dry and when they try to have sex, it's painful. And they don't want to have pain. Okay. This is proven. And they get hot flushes, mood swings, etc. These are all postmenopausal symptoms, which we all know about it. But these symptoms can be corrected. See, if she has got dryness, we can ask her to apply soft lubes. Water-based lubricants are available. Okay. Counsel them, talk to them, make them comfortable. Reduce their comorbid conditions. They may have arthritis. They may be having recurrent urinary infections. So all these things are manageable. When you manage all these things and be proactive, increase your romance, increase your touch to them, give them importance, give them priorities, compliment them every time when you are, even when she's doing something good or she's kissing you or hugging you, Compliment them. Women are connoisseurs of compliments. And even in the bedroom, even if she's helping you a little bit, compliment her, thank her, tell her she was beautiful, she was awesome. See, you can't have sex with a computer or a TV or a mobile. You need a partner, and she's there for you. So you need to, come out of all the inertias which you have, egos, misunderstandings. Just surrender. Just surrender. Nothing wrong in that. Absolutely. See, we must respect women. We are all born out of her here. We are not fallen from the tree. So if we can't uh, do anything good, don't do anything wrong to her here. Respect to देने में क्या जाता है? Adore, admire. See, a woman is a wonderful phenomenon God has made. She cannot be compared to anything else. And to respect your partner is something beyond words. The joy is beyond words. It increases your bond. You can get everything from your partner, whatever you need.
I think we are now reaching towards the conclusion, but before we finish, I must ask Ajay so if he has something left in his mind.
Yes.
So please come up with
Yes.
that so
So
that we can.
actually, there's a lot of stimulation going on in my mind, and I think we all will have very good nights today. So, and there is a very
I hope I have
interesting.
shared something which was needed for the
Yes.
doctors
And now I think a
very
lot of
much needed.
compliments and good gifts will also come in the picture in the coming times. So there is a very interesting concept of situational erectile dysfunction. And I think that's very common. And at times the males, they also just say that they have erectile dysfunction because they're not happy to do that thing. So that is also, may I ask you to elaborate it in brief, what it is?
Situational. See, if a man, you ask one simple question to him, that does he get morning erections in this last 10 days? Even once or twice, if he got up in the morning with an erection, he's normal. He doesn't need PD5 inhibitors. He doesn't need testosterone. His problems are psychogenic and situational. He may be having sex with his girlfriend, but not with his wife. It's a situational. Or if he's an elderly man, his secretary is very young, he can't get. He's tensed. So he can't get it. So that's a situational problem. You need to change the situation. That's it. They don't need medications. Psychogenic and situational erectile dysfunction is a problem here. It is not problem with any diabetes or this thing like that. So they need counseling.
I would request our Governor, Professor Anuj Maheshwari sir, that after this very scintillating talk, to give a formal vote of thanks to Dr. Jumani. I think he has given us a lot of insights, very interesting ones. Let's follow them.
And
Yes,
scientific.
Yeah, no doubt. Obviously, and today you were a little more scientific than we were really expecting because today we had to touch a lot of social issues related to a lot of social issues related to doctors and their routine life. But you were purely scientific. In fact, doctors were knowing about all these scientific facts. These scientific facts must be, but you did remind them, and that is a very important thing, so that they could know that what they are missing in their life, what the pleasure they are missing, and what is actually coming up in between them and their pleasure. So you realized from your presentation to them, and I am really very much grateful. You took time from your busy schedule. You prepared a special presentation for us for our well-being program for the doctors, those who are the part of our association. Most of the time, when we organize the program from our forum, may it be any organization in India or across the world, we always do it for patient. But rarely we think about our own community. Rarely we talk about our own community and our doctors' community. So at least I'm very much happy that ACP overall has thought about this idea that we should do something for the doctors, for their burnout, for their various issues, which may be financial, uh, which may be relation, which may be in their personal life. So every issue is being covered up, and we in India has also started a program, that is the well-being lounge from the India chapter. Soul Curry and uh, wonderful concept as initiated by my brother Dr. Ajay Tiwari, and he gave me this idea that I should start such program on this topic, and we started doing, and now it is getting very very much popular across the world. And I'm really very much happy to share with all of you, when I went in the Board of Governors meeting, everyone was talking about the soul curry. Everyone was talking about the idea of soul curry, of the concept of the soul curry what we have taken. And definitely today's program must have added a gem in this program, so that the people must have been benefited, and this program be more and more popular with the ideas and with the presentation what Dr. Jumani has already given. So with these thoughts, we shall be coming up with the new program next Tuesday, maybe on the 31st of this month, with Dr. Vidya Sundareshan. She is governor of Illinois chapter from USA, and she is from Indian origin. She is there, but she has a lot of ideas and lot of understanding of the Indian doctors and Indian population and people those who are living in India. And she shall be telling us about the gender bias in our doctors fraternity and what can we really do for that. So do join next Tuesday, 31st of October with us for this wonderful program. And for that, till that time, have a great time. Goodbye.
Thank you.
Bye-bye.